Pleased to meet you, doctor.
Just before we start, I want to be sure that you're Mr. Ahmed, the sons of Mr. Muhammad, our patient who came in the clinic in the last week.
Yes, doctor, I'm the one.
Is your father aware that you are here to discuss his medical condition with me?
Yes, doctor.
And he allowed you to gather the information about his case?
Yes, doctor.
Okay, Mr. Ahmed, can I know from you what exactly you know about the case of your father?
Yes, doctor, my father has been complaining of back pain and body ache and weight loss for the last 2 months. He received medical care for the last 1 week, and he was admitted in your hospital for the last 1 week, and you did some blood test for him, and what's called bone marrow aspiration. And I'm coming today to know about the result of my father, doctor.
Well, Mr. Ahmed, the results of the tests that have been done to your father came, and unfortunately, it wasn't as we expected.
Yes, doctor. What do you mean by that?
It means that we have found that your father has cancer in the blood, a disease called multiple myeloma, which is a serious disease actually.
Oh my God, are you sure, doctor, from this diagnosis?
Unfortunately, Mr. Ahmed, yes, we are sure about that. The examination of the bone marrow, which is the source of this cancer, was crystal clear when we found the cells and count them, and the results came out with this diagnosis.
Oh my God, doctor, I'm shocked. You know, my father was doing well just 2 months back. And he never complained from any disease, doctor.
I understand very much you're angry and you're upset about these results, and I'm so sorry for that, Mr. Ahmed, but unfortunately we are sure about these results.
Yes, doctor.
Well, actually, according to the results of the tests that have been done and the diagnosis that we have reached, we have to admit your father in the hospital for multiple disciplinary teams to examine him and to reassess him again, including the tumor doctor and the cancer doctor. And we need to admit him again in the hospital. And I want to get him to discuss things with him. He is going to come to the hospital.
He's admitted already, doctor, in your hospital. That's why you are doing such investigations for him.
Oh, sorry. I'm sorry. I thought he was done it on the outpatient clinic. Oh, I'm so sorry. Sorry. Okay.
Yes.
Okay, Mr. Ahmed, we are gathering the doctor for to meet your father and to set a plan for treatment for him for this disease, which could be including chemotherapy or radiotherapy, according to the cancer doctor to decide that.
Yes, doctor. Is it a serious condition, doctor?
Yes, Mr. Ahmed, unfortunately it is a serious condition. I'm so sorry about your father.
There is no hope, doctor?
There is always hope, and it's very early for us to discuss this issue right now, because the cancer doctor is going to set him a treatment, and according to the response of your father to this treatment, which is variable from one person to another, we're going to know the future plan of the condition.
Yes, doctor.
Can I ask about your concern, Mr. Ahmed?
Concern?
Yes.
Yes, doctor. My concern is that I don't want my father to know about his condition, doctor.
Well, Mr. Ahmed, I think that he has the right to know what's going on. Everyone has. And actually, most of the people who have serious diseases, they have internal instinct about what they have. And when we face them with the truth and the reality of the condition, that would be much more better than thinking about worse things. Let me meet him and talk to him, and I will discuss the condition with him according to what he wants to know from me.
Doctor, I know my father more than anyone else, and I know that if my father know about his condition will be deteriorated, and he psychologically will be depressed so much. So I'd like to be his condition to be secret, doctor. And we can manage him according to the best of interest of his condition without he know about that.
Well, Mr. Ahmed, actually, again, your father has all the right to know about his condition. And we need to have a consent from him for the serious treatment that he is going to receive. Let me meet him first and discuss things with him, and according to what degree of information he wants to know, I will tell him about his case. Is that okay with you?
Yes.
May I ask you with whom your father is living with?
He's living alone, doctor, because my mother died 2 years back, and he's living alone.
And you are not living with him, you are far away from him?
Yes, doctor.
Okay, let us you have to contact the social workers so as to manage having help for him when he came home after the treatment. And also, what about the financial support? Do you have any medical insurance?
Yes, doctor, he's medically insured, and he's financially supported.
Okay. And how much did you get from our conversation, Mr. Ahmed? Can you tell me if you clearly understand all the information that I gave you about your father?
Yes, doctor, I knew that my father has cancer in his blood, and that you're going to refer him to a multidisciplinary team to manage his condition according to the best interest of his condition. And you're going to tell him about his condition according to his queries and worries.
Okay, Mr. Ahmed, do you have any other question or other concern you want to ask me about, or to make me explain to you?
For how long is going to live, doctor?
It's too early for us to say that. Actually, we have to set the plan first according to the cancer doctor and the other doctors who are going to see him, and according to his response to the treatment, we are going to discuss how much he improves and how much he is finishing his treatment, and later on we are going to reset down again and discuss his condition.
Okay, doctor.
Okay, I'm going to give you some pamphlets and some websites about this disease so as you can understand much more about the condition of your father. And also, it is a community over the websites for patients and relatives of patients who can share experience with each other, which makes things more clear for you, Mr. Ahmed.
I'm so grateful for you, doctor.
Okay, thank you very much, Mr. Ahmed. See you.
Thank you, doctor. Okay, 9 minutes till you have 5 minutes. Okay.
I still have 5 minutes?
9 minutes only passed. Okay, so like our exam, exactly, there is no time to review and to talk again, that you close the conversation already. Okay, we'll do a bit discussion about this case. Anything missed here from Dr. Nagla? Okay, so let us start from the beginning. Yes?
I think from the beginning, the Dr. Nadla said that are you the first king of Mr. Ahmed? Do you want anyone to attend the meeting with us?
She didn't.
Because this is, I think, breaking bad news.
This is breaking bad news. She has to ask, do you want anyone else to attend our discussion?
Multidisciplinary team, I think, also should suppose anesthetist because the patient complain of back pain, the radiology doctor, the oncology doctor, and also to do for him more further investigation regarding his renal function because this multiple myeloma can affect the renal, and after that to include the nephrology.
Did you discuss the complications of multiple myeloma with the patient?
No.
Okay.
Should I discuss the complication with the son?
Yes, you have to explain for the son what's multiple myeloma and how much it affects the body and the body system. Okay, let's start from the beginning. There's a case of breaking bad news, and the skeleton of any case of communication is stable for all the cases. You have to salute the patient and check. You have to check. You have to identify yourself for the patient. I'm Dr. Nagla, Senior Officer of the Outpatient of the Medical Department. Nice to meet you. You have to ask about the patient and confirm patient identity. I'd like to confirm that you are Mr. Ahmed, the son of Mr. Hassan. Is it right? Yes, doctor. And you have to have permission that Mr. Ahmed has permission from his father. Are you the next of kin of Mr. Ahmed, and you are allowed to discuss this issue with me? Yes, doctor. Okay. This is breaking bad news. You have to ask, do you want anyone else to attend our discussion today? Okay. Then to ask open question, can I know please what do you know about your father's condition? Then to start your explanation of the disease. And breaking bad news actually has to be in a way that don't harm the patient or don't hurt the patient, and to keep the patient welfare, So you have to break the bad news in slowly, in diplomatic way. Dr. Nagla already she said to him that the blood test or the blood test has been released and it is not as we hoped. I think Dr. Nagla didn't say this sentence. It is very important actually to make the things or to make the information slowly released for the patient or to the relative. It is not as we hoped. And then wait for a while and then tell him it's revealed that your father has nesty growth or cancer. It's okay, but I prefer nesty growth in his blood. And then to wait for a while to make the patient to express his thoughts and his feelings and to ask him, what do you feel now, Mr. Ahmed? Of course, he will be angry, he will be shocked, he will maybe make cry, and then to appreciate his feeling. I'm really sorry for this bad information today. I appreciate your feeling, but be sure that we are going to do our best with your father. Then ask him, what do you know about this disease, which is called multiple myeloma? Do you have any information about this disease? He will tell you no. So do you want me to explain you more about this disease? Yes, doctor, please. Then explain what's multiple myeloma, complication of multiple myeloma, and management plan of multiple myeloma. Explanation of multiple myeloma, simply and in simple way, and avoid jargon, which is medical terms. The disease is a nasty growth of the blood. There is abnormal growth of abnormal blood cells in the blood, which invade the bone marrow, which is which is the blood manufacturer. And actually, it is a multi-system disease. It affects many systems in the body. It affects the manufacture of the blood, causing anemia. and causing also low white blood cells and easy infection, and the low platelet, so that it can cause easy bleeding. Also, the renal function can be affected of your father, and the calcium level can be elevated, causing some increased thirsty and depression and constipation. It can also affect the bone, and the maybe fragile bone and the easy fracture. It can also make the blood thick, which is the high viscosity. It can make the blood thick, also causing some dizziness and headache, and also loss of weight. Unfortunately, it is a serious condition. So you explained what's multiple myeloma and the complication of multiple myeloma. Complication, the bone marrow depression, and renal impairment, and hypercalcemia, and hyperviscosity, which is a thick blood. It is called thick blood. Then the management plan, we will refer your father to a multidisciplinary team, including a blood doctor, and also maybe a kidney doctor, and social worker, and psychiatrist, to manage his condition. Give hint about the treatment. The treatment may be in the form of chemotherapy, and maybe also what's called stem cell transplantation. And such this treatment can be discussed with the tumor doctor or the blood doctor in details. You are not the one to discuss in details the plan, the treatment of the patient or the treatment plan of the patient. Okay, there is no hope, Dr. Nagla. Okay, we'll continue, and then the concerns will be in the last. In the social history, very important. A social history, you have to ask about what's your father's job? With whom your father is living? And financial support. Excuse me, everyone is opening the mic to read the mic. Okay, so social history is very important. Yes, the patient job, with whom the patient is living, and financial support, smoking history, and alcohol history. Okay, this is very important, social history, communication skills, and in history taking, and in station 5. Then to give summary about what you discussed with the patient. Then to ask about the concern, very important. If you lost the concern, you lost all the exam. And the patient maybe has many concerns. Then to check understanding of the patient, how much did you get from our discussion today? Then to give help for the patient, help in the form of, I'm going to give you some leaflets, websites about this disease to know more about it. And I'm going to give you my contact number. If you have any worries or queries at any time, you can contact me. That's all for the skeleton. Okay? So this skeleton is fixed for all the case of communication skills. Again, and rapidly, salute the patient or check hands with the patient, identify yourself, check the patient identity, confirm agenda of meeting, and if it is breaking bad news, you have to ask the patient if he wants anyone else to attend the discussion, and then to start your scenario in the form of number 1, explanation the disease, explain what is the disease simply, and the complication of the disease, and the treatment plan of the disease. Then to ask about the social history of the patient, including 4 questions. What's the patient job and how much this symptoms affect his job and usual daily activities? with whom the patient is living, financial support of the patient, smoking history and alcohol history. Then to give summary about what you discussed with the patient, ask about the concern, then check understanding of the patient, then at the end help for the patient. Okay, so what Dr. Nagla missed here, explanation of the complications of the disease, including what's multiple myeloma. It is a nasty growth of the blood, or nasty growth cells of the blood, which is affecting many systems in the body. It affected the bone manufacture, causing anemia, causing easy infection because of low white blood cells, causing easy bleeding because of low platelet count. It can affect the kidney function. It can affect the bone, makes the bone more fragile and easy fracture. It can affect the blood, which makes the blood more thick. Then the treatment can be done by multidisciplinary team. And the most of the cases actually is the management plan will be by multidisciplinary team. Multidisciplinary team means that multiple subspecialties. The treatments will be in the form of chemotherapy or maybe bone marrow transplantation or stem cell transplantation, and this management plan will be discussed in details with the specialized doctor. Okay, so there is no hope that we will discuss the concerns now. He asked you, Dr. Nagla, there is no hope, doctor. You said to him, there is always hope. So do you think that you are giving the patient false hope? Multiple myeloma, it's known that multiple myeloma is an uncured disease and the patient is going to die within months maybe.
Should I tell him that there is no hope?
No, but you told him there is hope. I think. Do you think that you are giving false hope for the patient?
No, I don't think so.
Okay, so it's better, Dr. Nagla, to avoid both no or yes, okay? Because if you said no, he will write in his notes, the doctor will write that the candidate is right, is giving no hope for the patient. If you said to him yes, the examiner will write in his notes, the candidate is giving false hope for the patient. So, because this is a tricky question actually, and you are not going to satisfy anyone with this question. So, it's better not to reply no or yes. Okay? So, to tell him, the best reply will to tell him that unfortunately his condition is bad condition, okay, but we are going to do our best with him. And will give him the best treatment in the best interest of his condition. Okay? You know, Dr. Nagla, you know that the examiner are picking anything for the candidate to decrease the marks. So don't give them a chance to decrease your marks. Because this question is asked many times in the exams before, and anyone replied no or anyone replied yes, they decrease his marks. So be diplomatic and capture the stick from the middle. The condition is your father is difficult, but despite that, we are going to do our best with your father, and we are going to give him the treatment in the best of his interest. Okay?
Okay.
Okay, for how long he is going to live, doctor? You replied, it is so early to reply this question right now. And this is according to his condition, general condition, and the response for treatment. I agree with you regarding this reply. So it differs. I think the best reply for this question, it differs from one patient to the other according to his general condition and his response for treatment. and this question can be answered by the specialized doctor, because you are just senior health officer doing the communication. So some people are saying that I'm sorry, it may be months. Okay, so I think to detect a period time for that he is going to die in, I think this is not wise reply. So your reply will be diplomatic also. It differs from one patient to the other, according to his general condition and the progression of the disease and response for treatment. Okay, regarding the question that my father, I don't want my father to know about his condition, doctor. Of course, your father has the right to know about his condition, because he has to share his condition and the plan of management, and maybe he has some اللي هي الوصية اللي هي living well, or maybe he has living well he want to admit. if he يعني لو الصن صمم، وده يعني بيجي في بعض الحالات the son is persisting that his father not to know about his condition. Okay, we are going to give your father information according to his questions, or we are going to give him information bit by bit according to his worries and inquiries. But of course, the father has the right to know about his condition. This is the patient autonomy. Okay, he's checking your information about the patient autonomy. Patient autonomy, that means that the patient has to know about his condition and to share the plan of management. Okay, there is important question, Dr. Nagla, you missed in this scenario also. Do your father has any advanced directive or living well? Advanced directive or living well means الوصية يعني عشان الناس اللي حاضرة لأول مرة. Such this question has to be asked for all the patient with in breaking bad news or patient with cancer.
For this is important for me missing asking because of the DNR.
Because of DNR
or organ donation or whatever.
Organ donation, yeah, many things actually.
Yes.
Maybe his father, Johavs, for example, Johavs mean that this patient not receiving blood transfusion. This patient needs blood transfusion sometimes and the platelet transfusion. So if he has Johavs, maybe he has living well not to be donated blood. Okay, anyone has any question in this case? No question, okay. To shift to the other case.
Okay.
Okay. Anyone else want to present?
دكتور صادق.
دكتور مين؟
عمرو.
دكتور عمرو معانا تمام. Okay, Dr. Amr, another case of communication skills. Mr. Ahmed is 27 years old. He is a pilot. He has been complaining of syncope 2 days back. Blood investigation and the echo done for him revealing that he has HOCM. You are senior officer of the medical department. Your role also is to discuss with Mr. Ahmed his condition and any further concerns he has.
Okay, Dr. Salah.
Okay, we'll start time. Okay.
Good morning, Mr. Ahmed.
Good morning, doctor.
I'm Dr. Amr, the Senior Health Officer of the Medical Department today. Mr. Ahmed, would you mind to discuss about your problem today?
Yes, doctor, I'm coming for that.
Okay, but Mr. Ahmed, how do you feel today?
I'm better, doctor. Just this attack of syncope 2 days back. It's the first time to feel such these feelings, actually.
Yes, and when this happened 2 days back, you seek medical advice in our hospital that day.
Yes, doctor.
So what kind of, and what happened that day exactly? What kind of
doctor,
investigation?
I felt some dizziness, and then I collapsed suddenly for 2 or 3 minutes, and I woke up again. And I seek medical care in your hospital. They did some blood test and some imaging for my heart to know what's going on with me, doctor.
Okay, Mr. Ahmed. Honestly, the imaging, the heart scan done to you, Mr. Ahmed, unfortunately is not like we hope. Mr. Ahmed, are you following me?
Yes, Dr. Rajni, by not you hope.
I mean, the heart scan showed that you have maybe some kind of heart disease. We name it HOCM. This disease is, to be clear to you, it's maybe some kind of enlargement in your heart muscle itself.
Is it serious
Did you
condition,
ever
doctor?
hear about this? Actually, Mr. Ahmed, this condition may be linked to what happened to you 2 days back. I think Mr. Ahmed, first of all, I need to ask you if you ever heard about this condition before.
No, doctor, it's the first time.
Okay, Mr. Ahmed. Would you like me to go over more, to give you more details about that?
Yes, please, doctor.
Okay. Mr. Ahmed, this is one of heart diseases. Mostly it is a familial, by the way. And it can cause some enlargement in your heart muscle. And sometimes this kind of diseases can cause your heart rhythm problems, and it can cause the syncopal attack and the dizziness you found 2 days back.
Yes, doctor. Such this symptoms, doctor, can come to me again.
Yes, Mr. Ahmed, it can happen again, yes. And for this reason, there is lots of work we need to do to know the possibility that it can happen again to you or not. We need also to discuss if there is, if this happen again, there is special interventions can be done for you, Mr. Ahmed, to
So
prevent
there is
this
treatment
happen
for
to
this
you
condition,
again.
doctor.
Yes, yes, Mr. Ahmed. But it depends on the condition and the heart scan done for you. There is measurements. We need to know about it details to know exactly what kind of intervention you need. Especially, Mr. Ahmed, if this attack happened again to you.
Yes, doctor.
Mr. Ahmed, can I ask you about your job, please?
Yes, I'm pilot, doctor.
Okay. And do you smoke, Mr. Ahmed?
No, doctor.
Any alcohol intake?
No, never.
And what about your financial situation, Dr. Mr. Ahmed?
I'm financially supported well, doctor.
Okay, Mr. Ahmed, can I ask you about your concern now, Mr. Ahmed?
Yes, doctor. You know, my brother died 5 years back. He is my big brother, actually, and he died 5 years back suddenly. And they thought that also it is because of cardiac problem. Do you think, doctor, it is the same problem happened for him?
Okay, Mr. Ahmed, how old was he when he died?
He was 35, doctor.
Seriously. Actually, Mr. Ahmed, it's very well conditioned. It's very well known medically that your condition is familial. This means that it is a genetic, and maybe it's due to a gene defect running in your family. This can be, Mr. Ahmed, can be that your brother had the same problem you had.
Yes, doctor.
For these reasons, there is specific measurements and the heart scan done to you. We need to know about it. Regarding the syncopal attack and the dizziness happened to you, it's directly related to this condition, and there is a special device can be implanted later on if you develop this attack again, Mr. Ahmed. This device can protect you. If some rhythm problems happen to you, it can stop it immediately just to protect you, Mr. Ahmed.
Yes, doctor.
Mr. Ahmed? Are you following me, Mr. Ahmed?
Yes, doctor.
Okay, great. So, Mr. Ahmed, can you tell me how much information you did you get from our meeting today?
Yes, doctor, I knew that, unfortunately, that you did some imaging for my heart and you discovered that I have a disease affecting the muscle of my heart, which makes the muscle of my heart is enlarged and interfere with the function and pumping function of my heart, and also causing some troubles in my rhythm, my heart rhythm. And that you are going to refer me to a cardiologist to give me the proper plan of management. And it is a familial disease. It means that it runs in family. Thank you,
Mr.
Dr.
Ahmed. I need to ask you one more question.
Yes.
Mr. Ahmed, I need to ask you one more question about, you told me about your job. So you are a pilot.
Yes, doctor.
You still working till this moment?
Yes, doctor. I was driving an airplane to 3 days back, doctor.
Well, Mr. Ahmed, I think this is very serious situation, because I am afraid you may develop a similar attack like happened 2 days back while you are on one of these traveling jobs. So I advise that we need urgent referral to a heart doctor, to cardiology, and also to temporarily stop doing your job as a pilot till we finish this issue. How do you feel about that, Mr. Ahmed?
So, doctor, are you going to shift me from my job?
It's too early, Mr. Ahmed, to answer this question honestly. So we need to finish our workup first with the cardiologist, with the specialist who will be responsible for you. And I think later on the picture will be very clear to answer this question. But it's very early to answer this question today. Honestly.
Yes, doctor, because I like and I love my job so much. So I cannot change my job at all.
But Mr. Ahmed, honestly, I am afraid to tell you that it's very dangerous to work as a pilot while you have this condition without proper investigation and proper workup. To know exactly at least how much it affects you.
Yes, sir. So I'm going to continue or I'm going to stop my job, doctor.
So at least till you meet our cardiologist, I will send you a I will refer you to the cardiology, and to finish the workup, we need to finish with him, and after this we can make a meeting with the cardiology and with you, of course, and to discuss this issue exactly, while to stop or to continue. But at least till we reach this meeting day, I advise to stop completely traveling abroad as a pilot.
Okay, doctor.
Okay, Mr. Ahmed. I will give you my telephone number and a number of leaflets and websites about your condition to be more familiar, can give you more information maybe I missed to give you today, Mr. Ahmed.
Yes, doctor. So grateful for that.
So, Mr. Ahmed, would you like to ask me any questions or to go over again about any point in our meeting?
No, doctor. It's okay.
Okay, thank you, Mr.
Thank you, doctor. Okay, 12 minutes.
شكلها مليئة بالأخطاء.
ليه بس؟ يعني خليك متفائل يا دكتور عمرو. طيب okay. Okay, doctor, do you think that you said all the information for Mr. Ahmed regarding his disease?
Honestly, I feel I didn't tell him too much about the condition.
Okay, I told him there is enlargement of the wall of your heart walls. Okay, but what this enlargement cause?
And I told him about it is a genetic problem. Genetic problem caused that.
Yeah, no,
So I think Dr. Sadiq means that the thickening of the heart muscles prevent the blood to go to the certain parts of your body. Is this right, Dr. Sadiq? Is
yes,
what you mean?
Yes, Dr. Anagla. So,
Dr. Sadiq,
yes.
can I?
Okay.
Dr. Sadiq,
تفضل دكتور ياسر.
No?
Right. Something important about HOCM, there is, you should tell the patient there is hypertrophy in your cardiac muscles, mostly involving two parts, the septum of the ventricle and the posterior wall. And this hypertrophy can cause, with exercise, some dynamic obstruction to the blood flow to your aorta, which can cause symptom of syncope, palpitation, and sometimes it can be fatal, yani, these things. And I should speak.
But we have to avoid all jargons, and we have to avoid any medical term. Hypertrophy is medical term actually that we have to avoid. So
Muscle
hypertrophy
thickness of the muscle.
okay, thickening of the walls of your heart. You can
Thickening.
you can give him hint about the heart, and you can draw the shape of the heart. The heart is composed of 4 ventricles. Okay, so but don't push a lot of information for the patient. Your heart has 4 ventricles, and it is a muscular organ. So the muscles of the heart or the ventricles are enlarged to some limit, not to push the heart or pump the heart forcefully to the body. So, and also it can cause some obstruction to the valves of your heart, and this can cause the blood not to reach your body in proper way or in proper volume. That's why you can feel some dizziness, syncope, and some also shortness of breath, and also maybe sudden death, unfortunately. I'm sorry to tell you like that, Mr. Ahmed. Something I want to focus on the welfare of the patient. And most of us is not saying, I'm sorry for that. I appreciate your feeling right now. How do you feel now? Be sure that we are here to help you as much as we can. Such as this sentences are very important in communication skills, because empathy and sympathy is very important with the patient. Okay, don't talk with the patient like he's a machine. Okay, look to the patient eyes, because the examiner are looking to you what you are doing with the patient. Look to his eyes, and body language is very important, and some sentences are required for the patient empathy and sympathy. I appreciate your feeling now. I know how much it's hard for you, but be sure that we are here to help you as much as we can. Such a this sentence is very important, okay? Then also regarding the complication of HOCM, Dr. Amr, he said that it is enlargement or muscular enlargement of the muscle of the heart, which weakens the heart and make him weak to push enough blood to the body, and also it causes some narrowing of the valves of the heart, and also rhythm or disturbance of the electricity of the heart. Okay, as such, all of these can cause syncope, shortness of breath, dizziness, and unfortunately even sudden death. I'm sorry to tell you like that, Mr. Ahmed. This is the explanation of the disease, and this is a complication of the disease. Regarding the treatment, we are going to refer you to a cardiologist to give you the proper plan of management. And a plan of management will depend on your condition according to the follow-up with the cardiologist. Okay.
May I add something, Dr. Salim?
تفضل يا دكتورة نغلة.
Should we ask the patient about if he's married or not, because this is an autosomal dominant condition, and if he's married, his children having a 50% chance to have the disease, so that they should be screened. And another question, to ask the patient if he's driving or not, because he should not drive till the full investigation and the plan of management should be done. And at the end of the discussion, we should tell the patient if he needs anybody to drive him home, or we can provide him a taxi for driving him home.
I agree with you completely, Dr. Nagla. Any patient with breaking bad news, you have to offer him anyone to drive you home. if you don't have anyone to drive you home, we can provide you with someone to drive you home. This is one of the to provide empathy and sympathy for the patient. Being a pilot, this is very risky actually for patient with HOCM. Dr. Amr, you told him that we are going to do further investigation and follow up, and according to that, we'll take decision. Do you think this patient can drive the airplane with 500 people in it?
No, I don't think.
No.
This patient can suffer from not even syncope, but even sudden death while he's driving 500 person, you know, even if he is on treatment. So he bought such a job for you to check how much you will deal with the patient with HOCM he's acting or working as a pilot. So of course you have to provide to, we are going to contact occupational health care worker to provide you with a more safe job and job which is not risky for the others. Hey, like, how can doctor, this is my job and this is my life. Are you going to change my life? Of course he may argue with you. I'm sorry for you, Mr. Ahmed. I know how much you are feeling now, and this is a difficult decision. But you know, this is very risky for the others also. So that we are going to provide you with a job which is more safer in your condition and for the other condition. تمام. يعني هو هيشتغل ايه البايلوت؟ ممكن يشتغل بقى يعني في يشتغل في المطار في اعمال مكتبيه ان اوفيسر او حاجه زي كده عشان يبقى طبعا بعيد عن الريسك. دكتوره نجله اثرت نقطه مهمه جدا، فكره in social history also in such a case you have to ask about family history or any one of his family died in young age. هو قال لك بالفعل ان اخوه died in young age. Okay, what about your children? Do you have children? Okay, Dr. Nagla, let's ask you how to do screening for his children. Do you think it is genetic testing or it is by ultrasound?
I think genetic testing.
My echo.
Or echocardiography.
No, my echo.
Echocardiography, what's the rule of genetic testing for this case?
No, I don't
Detect the
know.
mutation.
There is a rule. There is a chromosome.
Dr. Sana?
There is some mutation. Yes, there is some mutation in the chromosome, in the I think genes in the patient with the HOCM. So
Okay,
also
so
the genetic.
we are going to screen the if he has a children. Okay, so ask him, do you want your children to be screened for this disease? Because unfortunately 50% of our every one of your children has 50% to have the disease. Okay, and if we discover the disease earlier, this will give us advantage in the form of starting the treatment early for him and early follow-up with cardiologist. This case came last died maybe 3 to 4 times in 4 centers, different centers. Okay, any question for this case?
Dr. Sadiq?
Okay.
Hello?
تفضلي يا دكتورة سنة.
I am Dr. Safa. I want to ask if it is mandatory for case for breaking bad news. It is mandatory to ask the patient if he want someone to attend with him.
It's not mandatory, but it's important to mention. You know, it's one of the patient welfare. Anyone else to attend our discussion to support him. But of course, not in the case of HIV, for example, HIV infection, if the patient has HIV, so the information has to be only for the patient. So in
For
HIV
some
infection, for
cases only.
example, confidentiality in HIV has to be considered so that not anyone to attend the HIV Breaking Bad News, for example, but any other Breaking Bad News like, chronic illness or cancer, you have to ask him about this question. مش هنخسر حاجة.
Yeah.
Okay, ناخد next case. Don't forget to give summary for the patient about what you discussed. Check understanding for the patient. How much, can I know how much did you get from our discussion today? Check understanding how much the patient got from your discussion. And at the end, of course, don't forget about concern. The concern is exam. Don't forget to ask about, don't forget to give help for the patient, okay, at the end. Next case, station 5.
لو دخلنا دكتور مصادق بعد اذنك.
مين معايا؟ مش عارف اصلا اللي بيتكلم.
عمرو يوسف يا جماعه.
اتفضل يا دكتور عمرو.
حضرتك لو دخلنا في قصه الجينيتك تيست فور ذا تشيلدرن. طبعا الحكايه دي ليها قواعد، يعني المفروض هل موافقته هو هتبقى كفايه ولا المفروض الولاد نستنى لما يوصلوا سن معين بعد كده هم اللي ياخدوا القرار ده، ولا هنسير الموضوع ده ازاي؟
لا هو يعني he can't take the decision for his children, okay, because this is for their يعني sake. فبالتالي لا احنا مش هنستنى لغايه ما هم يكبروا بعدين هم ياخدوا decision. He can take decision for that, and if he took decision to be screened, you can send him for genetic test team or genetic team for that. لكن هو ال screening for HOCM mainly by echocardiography.
دكتور صادق
حتى في حالات اتفضلي يا دكتورة سنة.
دكتور صادق I think yes أنا دكتورة سنة I think this genetic test not for all condition, only if the condition we can discover, if discovered early and the children's treated condition, it can be treated and they will benefit, they can go, otherwise no.
I didn't get your point here, Dr. Sana.
Okay, sorry. I think this genetic test for disease, when discovered early, and the children can get benefit from discovering early and treatment, so it will go. Otherwise, no. Like in some condition can treat it, like hemochromatosis and Wilson disease, like that. Otherwise, no need.
Like polycystic kidney disease, for example, there is no rule in genetic test in this case because the screening will be ultrasound after age of 20 years old.
Excuse me, Dr. Sadiq, I have something to add.
Okay.
I think there is no benefit from early discovering. I am Dr. Yahya.
Hello, Dr. Yahya.
I think there is no benefit from early discovering if there is a genetic mutations for HOCM because the age of risk is from 18 to 30. So there is no benefit from discovering if this patient is susceptible to get HOCM when he grow up. At age of 18, it will be very enough to do echo. So I think there is no benefit from screening patient for the mutation. Especially if young age 5 or 6 years, there is no benefit from that. And because even if it's positive and they have the genetic mutations, it's still nothing to be done.
Yes, it is the same idea of polycystic kidney disease. There is no benefit to discover the disease
Yes,
early.
yes,
So you are going to do ultrasound after the age
yes,
of
that's
20.
right.
Okay.
Yes, that's true. It's the same condition here.
Okay. Thank you, Dr. Yahya. Next case, station
Thank
5.
you.
Anyone is going to present the case? Station 5. يا زمان كانوا بيتخانقوا على مين اللي يقدم الحالة، بس طبعا عشان احنا عندنا نيو
أنا يا دكتور صادق يعني I am very يعني eager to do it، بس أنا I want to make a chance for other people to attend here.
في الدكتورة مي علي بتحضر معانا من زمان. الدكتورة مي مش بنسمع صوتها خالص.
أيوه بالظبط كده.
دكتورة مي؟ I think she preferred to be just listener. Okay, we will go with Dr. Nagla again.
Okay.
And Dr. Nagla actually is a very good sample for you as a beginners for basis.
Thank you very much, Dr. Sadi. You are the master. Thank you very much.
Okay, station 5, because we have a lot of candidates beginners, so station 5 is different. Okay, station 5 is 10 minutes. Okay. It is 8 minutes with the patient and the 2 minutes discussion with the examiner. Station 5 is focus history, examination, and the concern. Okay. So the skeleton of station 5 is to introduce yourself, check the patient identity, and then start to ask about the complaint, analysis of the complaint, onset, course, duration, progression, devastating factor, improving factors, associated symptoms. Then ask about your differential diagnosis or systemic review related to the case itself. Then to ask about social history of the patient, including the patient job, how much your symptoms affect your job and usual daily activity, with whom the patient is living, financial support, smoking history, alcohol history. Then to ask about family history, medical history, and drug list of the patient. Then to ask about the concern. Of course, during such a test, you have to examine the patient. Focus examination related to the disease itself. This all in 8 minutes only. Okay, so we give sample now. Mr. Ahmed is 42 years old. He has been complaining of back pain and neck pain for the last 2 months. For your kind care. This is a letter from the GB. You are senior officer of the internal medicine department. You are asked to discuss the issue or the condition with Mr. Ahmed.
Okay, doctor.
So you are giving also white paper, and you are given 5 minutes before going to the station 5. Station 5 is 2 patients or 2 cases. Okay, you are giving 5 minutes before going inside the room to see the 2 cases. So you have to read the 2 scenarios of station 5 well properly before going to the station, and to write the notes that you want to write in the white paper, not to forget something. Station 5 is tricky. Station, it is 76 marks. Mean that it is maybe third of the exam. And that is the time is very short, 8 minutes, to make all of these. but it is easy station if you did it properly and frequently with your colleagues. You'll find it very easy station, inshallah.
Okay, good morning, Mr. Ahmed. I am Dr. Nagla. I'm the senior house officer in the clinic. Pleased to meet you, sir.
Nice to meet you, doctor. We are going to discuss, of course, in Egypt, for example, sorry for interruption, Dr. Nagla. If you are in Egypt, for example, of course, there will be a surrogate with the patient. She will be present with his son or his daughter, maybe. So you are going to ask the son or the daughter and to examine the patient himself. The patient will not talk in English, of course, so they are giving surrogate, okay, as his son or his sister. So Dr. Nagdi, we are going to discuss the issue with his daughter, okay?
Okay.
Okay.
Just before we start, I want to be sure of the information that I have, that you're Mr. Ahmed, you're 42 years old, and you are complaining of back pain and neck pain for the last 2 months. Am I right?
Yes, doctor.
Okay. I just want you to tell me more about this pain. When did it start exactly?
This pain started 2 months back, doctor, and my lower back and my neck, and it is increasing with me, actually.
And did you? This is the first time for you to have this attack of pain?
Yes, doctor, 2 months back.
And didn't have any trauma before this pain came?
No, doctor.
And this pain started suddenly or gradually?
No, gradually, doctor.
And all through these 2 months, the pain is the same or increasing or decreasing?
It is increasing slowly, doctor.
And is there anything that increasing this pain?
Like what, doctor?
Like lifting things or extra work or standing up or lying down?
No, doctor, actually resting is increasing my pain.
Oh, yeah. And is this any diurnal variation for this? It means that this pain is more in the morning or late at night?
More at the morning, doctor.
This pain is associated with the stiffness of your joints or any difficulty in the movement?
Yes, doctor, yes. There is stiffness. In the morning more.
It is all through the day or increasing more in the morning?
In the morning more, doctor.
Okay. Is there any associated weakness of the muscles?
No, doctor.
Okay. I'm so sorry for that, Mr. Ahmed. I want to ask you a lot of questions about your case. Maybe you think that it's not relevant for your complaint, but it's very important for us to complete the whole picture of your problem. Do you have any problem in your eyes? Any grittiness of your eyes?
No, doctor.
Any blurring of vision?
No.
Any dryness of your mouth?
No.
Any sores of your mouth?
No.
Any sores down there?
No.
Any problem with your waterwork?
No.
Any problem with your back passage?
No.
Any difficulty in the swallowing of the food?
No.
Okay. Do you have any shortness of breath?
Sometimes, doctor.
Can you allow me to examine you, please, while we are continuing asking the question, Mr. Ahmed?
Yes, doctor, of course.
There's no dry eye, any abnormalities of the conjunctiva of the patient?
No problem with the eye at all.
What about the lifting of the chest? Is there any expiratory or wheezes or crackles or rhonchi?
No.
There is nothing, chest is clear.
Yes.
Okay. Mr. Ahmed, do you have any problem of your feet?
My foot?
Yes?
No problem, doctor.
Any pain?
No.
Any contractions?
Any what?
Okay. Mr. Ahmed, do you have any increase of thirsty or your ability to drink water?
No, doctor.
Okay. May I ask about your job, Mr. Ahmed?
I'm working as a driver, doctor.
And how much is this pain affecting your job?
It affecting, doctor, because I have some problems, looking to the left and to the right.
Is this affecting your day-to-day management in your work? Do you have a sick leave recently or something?
No, it's going on, doctor. I'm still driving.
Okay. Can you manage it with difficulty? Do you want us to contact the social worker so that they can afford you another job?
Okay, doctor.
And who you are living with, Mr.
No, why to offer me another job, doctor? I'm doing well with my job. I like my job.
You are doing well. This pain in your back and your neck is not affecting your daily management of your work?
It's okay, doctor, but I can manage.
Okay. And with whom you are living with, Mr. Ahmed?
I'm living with my wife, and I have 2 sons, doctor.
And is any affection of your family life with this back pain?
No, it's okay, doctor. I can manage.
Do you smoke, Mr. Ahmed?
No.
Do you drink alcohol?
No.
Okay. May I ask about your concern, Mr. Ahmed?
I'm concerned about this back pain, doctor. What could be?
Actually, Mr. Ahmed, after examining you, and during the examination, there is no tenderness in the back of this patient, any swelling in the neck?
No.
Okay. May I ask the patient to stand up beside the wall of the room of the examination room?
Yeah, the patient is standing up now with some difficulty and slowly. Okay.
And he is standing up straight to the wall, or there is humping his back?
There is distance between the occiput and the wall. He cannot reach the occiput to the wall.
Yeah. And I'm going to do a modified Schubert test for this patient to see if there is a more than 10 centimeter or no when he is leaning forward.
Okay, no need,
okay.
Doctor, it's okay.
Okay. Okay, Mr. Ahmed, about your condition, I think that we are going to do more investigations in the form of imaging your back, your vertebral column, so that we can detect what is the problem of your back. Because there is a serious condition that appears at your age called Ankylosing spondylitis. We just want to be sure that you are having or you are not having this condition. Together with the multiple. Well, actually, it would be a serious disease, and we have to do a special arrangement for you if we discover that you are having this problem. Another multiple disciplinary teams in the form of a heart doctor to examine your heart, and the eye doctor to examine your eye, and the chest doctor for your lungs. Because this disease is not affecting only your bones, but it could affect another part of your body if you are having this one. So we are going to do multiple investigations for you, Mr. Ahmed, and we are going to reset another session with you to discuss the results. Is that okay with you?
Yes, doctor.
To summarize the discussion of what we are having today, I examined you and you're having it.
There is no time to summarize.
No summarize.
Okay, so I have another question, doctor. My son may have the disease?
Your son is having the disease. Actually, هو ankylosing spondilitis that run in the family? I don't remember.
Okay.
طبعا.
I don't remember the autosomal dominant.
No.
No, it does not. I don't think it's not a familial disease. It's not a familial disease. It may be 27 years, but it is not runs in the family. Well, it runs.
Runs or not runs?
No, it does not run.
Not run.
Not run.
That's not run.
Not run.
Not run. Not run. Not run.
واضح إن في إجمال not run. Okay, so.
run بقى في الآخر بقى.
Okay. So. Okay.
Not run, but we need to do HLA-B27 screening.
HLA-B27 screening, yes.
HLA-B27 is only a risk factor, but not a.
Hello?
Okay.
معلش دكتور صادقة, I'm on call. I'm coming now. It is not run in family, but the children have high susceptibility to get the disease than others, member of the community.
دكتورة سنة بتتكلم ولا دكتورة أم سنة
أنا مي. أنا دكتورة مي.
We are calling you for time to present the case.
Because I'm on call.
You are in call.
I'm on call from time to time. I come to listen.
Okay. لما جيتي بقى جبتي الخلاصة يعني. Okay. So like Dr. May said, okay, there is no specific mode of inheritance of this disease, but your children, the chance of your children to have the disease is more than the others. Okay? It is the same like vitiligo, for example. Vitiligo, there is no mode of inheritance for it. Vitiligo also, the chance for children to have the vitiligo is more than the others, despite there is no specific mode of inheritance for the disease. Vitiligo is inherited in the form of polygonal genetic. Okay, so finish the case. Okay, already, Dr. Nagla, we finished the case?
Yes, sir.
Okay, what's your diagnosis in this case?
Ankylosing spondylitis is one of the first diagnosis to me. Then it could be seronegative spondyloarthritis. It could be Reichel disease, but it is what is against is the patient does not have any eye problem, any waterwork problem. It could be
right, there is one of the seronegative arthritis.
Yes. So it related to all the seronegative. It could be the arthritis second to the inflammatory bowel, but what is against the patient is not complaining of any back passage problem.
Also, this is chronic arthritis, which is one of the seronegative arthritis.
Idiopathic, yes.
So you bought
psoriatic arthritis.
The first differential diagnosis. What was this diagnosis?
Yes, ankylosing spondylitis is my first diagnosis.
What's going on with this diagnosis and the history, doctor?
The stiffness in the morning, especially in the morning, and the rest that increasing the pain. Actually, in this inflammatory condition, the rest decreases the pain.
What investigation you are going to do for this patient to confirm your diagnosis?
First, I'm going to plain X-ray of the vertebral column for the sacroiliitis.
Yeah, if the X-ray is normal in this patient.
MRI.
Okay, but still, X-ray has a gold standard.
Yes, X-ray is the basic investigation that we are going to do. And we are going to do all the inflammatory markers for his CRP and ESR.
Yes. What else?
What else in the investigations? I'm going to do a colonoscopy for him because the patient with the ankylosing spondylitis had the ACE disease, the iritis, and I would like to do a chest X-ray because of the.
Anterior uveitis.
Yes, anterior uveitis, the ACE disease, anterior uveitis, the aortic spondilitis, and the fibrosing alveolitis of the chest. I would like to do a chest X-ray too, echocardiography.
Thank you. What you're going to see in the echo in this patient? What do you suspect?
I'm not hearing you. Aortic regurg.
Aortic regurg, yes. Okay. Okay, this patient had shortness of breath. What could be the cause of shortness of breath for this patient?
Fibrosing alveolitis.
Apical fibrosis, you mean?
Yes. Yeah. What?
Apical lung fibrosis.
Apical. That's apical lung fibrosis.
Yeah, what else?
The aortic regurg,
pulmonary hypertension.
Yes, pulmonary hypertension and the kyphoscoliosis that's caused by the leaning forward of the patient causing restrictive pattern of the lung.
Okay. I agree with you. What else?
What?
Aortic related
ممكن cardiac conduction defect أو amyloidosis يبقى splenomegaly.
I agree with you completely, Dr. Yahin. Okay, amyloidosis can cause nephropathy. Okay. Okay. Thank you, Dr. Nagla, so much. So, this is station 5 of a case of ankylosing spondylitis, which is coming very frequently in Egypt. And there is case in Egypt associated in تيجي في مصر ankylosing spondylitis ومعها كمان psoriatic arthropathy combined case كده طبعا complicated. For the asking of the complaint, this patient, the main complaint is back pain. So, in onset, when this back pain started exactly, and where is this back pain? Is it in the lower back, middle back, upper back, in the neck? Course, is it increasing, decreasing, or the same? Course with duration, is it in, it came suddenly or gradually? Is it coming on and off or all the time with you? This is a progression. Then associated symptoms, any other joint pain involved, any history of trauma, to exclude trauma also. And to ask about differential diagnosis. Of course, patient with back pain and neck pain, you will consider ankylosing spondylitis as the first differential in your mind, even before seeing the patient. Of course, will not give you patient with a cancer with metastasis and back pain in station 5. It is impossible. So if a case of back pain came in the exam in station 5, you have to consider ankylosing spondylitis or psoriatic arthropathy. For example, no other case in station 5 come in as a case of back pain, such only these two cases. Okay, it is difficult to discover the patient is laying down and is covered, and if you are smart enough, you can make the patient in the beginning to look to the right and to the left. Of course, there will be limitation of movement, so you can pick the diagnosis early. You can ask about enteropathic أو يعني اللي هو seronegative causes. Seronegative causes طبعا includes psoriatic arthropathy. You have to ask about skin rash. And enteropathic arthritis. So you have to ask about loose motions, and
Loose motion.
yes, and writers. So you have to ask about dysuria or burning micturition. Then to ask about the symptoms of ankylosing spondylitis. احنا عندنا في 7A for ankylosing spondylitis. هنبتدي من فوق لتحت علشان يعني نفتكر حسب البيشنت anatomy. الeye anterior uveitis. So you have to ask about any eye pain, okay, or eye redness. هننزل تحت شوية بيبقى عندهم
apical fibrosis.
Apical lung fibrosis. So you have to ask about any cough or shortness of breath. هننزل تحت شوية الهارت بيبقى عندهم aortic regurg and AV conduction defects. So you have to ask about all symptoms of the cardiac symptoms: chest pain, racing of heart beats, shortness of breath, leg swelling. هننزل تحت شوية هنلاقي عندهم tendo Achilles or Achilles tendonitis. You can ask about any ankle pain. بيبقى عندهم كمان amyloidosis يعني no specific amyloidosis يعني فبالتالي هنسأل يعني ايه في الاميلودوزس صعب شوية. Through the urine for yes nephropathy. Okay, من amyloidosis. ممكن. Okay. Then to ask about the social history for the patient. Social history, what's your job? How much the symptoms affect your job and usual daily activities? With whom you are living? Are you financially supported? Do you smoke at all? Do you drink alcohol? Do you have any family history of similar condition? وبعدين هنسأل عن family history. Any history of family history of similar condition or long-standing disease? Any long-standing medical disease you have, like diabetes, hypertension? Do you have any drug list? Okay. Then, to start your examination, you can start your examination during asking the questions, not to waste time, especially with the social history. يعني social history محفوظ أنت حافظه فبالتالي عشان ما تضيعش وقت وأنت بتسأل في social history تعمل examination. Examination نعمل أول حاجة to make the patient to stand up. The patient will have a stooped posture or a question mark posture with loss of lumbar lordosis and kyphoscoliosis. وبعدين هتعمل الماسكوسكليتال examination بتاعك الدكتورة نجلة ما عملتوش to make the patient to look downward and upward, to flex and extend his neck. Okay, to look to the right and to look to the left. Of course, there will be limitation. To make the patient to lean forward إن هو كده يعني زي وضع الركوع. Okay, lean forward. Okay, of course there will be limitation. To make the patient to move laterally, the right and left, حرك السباين بتاعه يمين وشمال. Of course there will be limitation. Then occiput wall test like Dr. Nakla did. Make the patient to stand beside the wall and make his occiput to touch the wall. Of course there will be limitation and a distance more than 5 centimeters. Then to ask the examiner, I'd like to do modified Chopper test. Of course modified Chopper test will not be done at the exam, but just to show the examiner. He will tell you, no need doctor, go on. Then to examine the systemic review related to the condition. So you have to put your stethoscope on the apex of the lung for apical lung fibrosis. You have to examine the eyes for anterior uveitis, just to look for the eyes. You have to examine the heart and to put your stethoscope in the aortic area for aortic regurg, and to examine the pulse for any AV conduction defect. That's all in the examination. Okay, regarding the concern, Dr. Nagla, this patient is driver. Do you think that his driver is a safe for the public and for himself?
I think the problem is not being safe. I think the problem that he cannot afford to drive because of the pain.
No, what about looking to the right and to the left and to behind? This patient can look to the right and left freely?
Actually, he did that with difficulty, or he cannot do this.
Okay, I agree with you. This is
He told me that he can manage driving.
Ankylosing is not thought as a case of banned from driving, okay? But this patient still has risk for himself and for the others. So I'm going to refer you to DVLA team, and they are the one to decide that you are legal for driving or not. Okay?
Yes.
Don't ban him from driving, okay? But let this issue for the DVLA team. Investigation to be done for the patient.
I will tell him that I will refer him to the. Suppose he asked me, should I drive till I being referred to the DVLA? Should I answer?
Okay, it's better to avoid driving until to be referred to DVLA, and they to decide that you are legal or you are fit for driving or not.
Okay.
Investigation to be done, like any case, basic investigation and specific investigation. Basic investigation, CBC, light, kidney function, liver function, and the inflammatory markers. The specific investigation in the form of X-ray spine, and if the X-ray is query or not confirming the diagnosis, we can proceed into MRI spine. And also other investigation for other systems, Dr. Nagda, that you missed chest X-ray. I think you mentioned chest X-ray, echocardiography, ECG.
Yes, I've told you that we are going to do echo and chest X-ray.
Oh, okay, I'm sorry for that. And the ECG also for AV conduction.
Can do lung function test.
مش هتفيدنا قوي يا دكتورة يعني معي pulmonary function test if there is يعني impaired function يعني في severe shortness of breath يعني for example والpulmonary function test مش هتبقى diagnostic for pulmonary fibrosis
I think if I have something in the chest X-ray, I would refer the patient to do high resolution CT chest.
Okay, this is a diagnostic for pulmonary fibrosis. Okay, we finish this case. Do you want to proceed to another case? That's enough for today.
Yes. No, another one.
استطلاع. استطلاع للرأي. كملوا يا جماعة ولا كمان حالة ولا that's enough for today?
Yes.
دكتور ياسر.
Yes, another one.
Okay.
نكمل.
يبقى ده صوت التانية. دكتور ياسر.
Another one.
نكمل.
Okay, دكتور.
كمل يا.
كمل ماشي اوكي.
نكمل.
Okay. موافقة. The other case, station 5. With Dr.
Hello?
Yes?
I can do Dr. Sabi.
دكتورة مين؟ ماي ولا دكتورة سنة؟
مي. دكتورة مي.
دكتورة ماي اوكي.
أنا ممكن أعمل لكن ما عارفة إذا حيطلبوني ولا لا because I'm on call.
Okay.
But let us start no problem.
إن شاء الله يعني بسرعة يعني بتمر بسرعة مش طويلة. Mrs. Hala is 25 years old. She has been complaining of a right-sided weakness today morning, which resolved after 1 hour. You are senior officer of the medical department. Please focus examination history and the concerns reply.
Okay.
Also, this case is frequently coming in the exam. Right-sided weakness in young-aged female patient. What's your differential diagnosis before going to your station? Ask about the differential diagnosis you have and what in your mind, what system you are going to examine frequently. Prepare me like a report because there is no time at all. دكتور يحيى معنا؟
نبدأ؟
It's okay. Okay.
Okay, good evening. I'm Dr. Omei, a senior assistant in the medical clinic. Nice to meet you.
Nice to meet you, doctor.
Okay, first I want to confirm that I'm Mrs. Hala, 25 years old, came complaint of right side weakness. That is right?
Yes, doctor.
Okay, Mrs. Hala, can you tell me more about your condition?
Yes, doctor. Today morning at 11 o'clock, I suffered from sudden right-sided weakness, which continued for more than 1 hour, but it's completely resolved now, doctor, and I'm completely well now.
Okay, I'm so sorry for that. You tell me this is started for 1 hour. You cannot move your hand completely, or there is some range of movement?
No, doctor, it's just, weakness, not severe weakness actually, but I have, like heaviness.
Okay. This weakness related with any impairment of sensation?
No, doctor. Sensation was completely well.
Okay. Okay. Is this confined to the right arm or to the other part of your limbs?
My right arm and the right leg, doctor.
Okay. Which starts first or the same?
The
same time starts.
Same time.
Okay. Okay. Is there any association with any loss of speech?
No, my speech was okay, doctor.
Okay. Any loss of vision?
No, doctor.
Okay. Any headache?
No.
Okay. Any disturbance in your pulse?
No.
Okay. This is the first time for you, or that is okay before?
No, first time.
Another attack in the past. Okay. Is there any skin rash?
No.
In your body? Any joint pain?
No.
Okay. Any history of blackout?
No.
Okay. Any history of reason of your heart?
No.
Or awareness of your heartbeat?
No.
Okay. Do you have any in your health, any problem in your health before?
No, I was completely well, doctor.
Okay. What about your mood?
I was so shocked today, doctor, because of the symptoms, but it's okay now.
Okay. Do you have any stress in your health before?
No.
Okay. Any disturbance in your water work?
No.
Okay. Do you have any history of trauma of your head before?
No.
Okay. Do you have any history of syncopal attack before?
No.
Okay. Any neck pain?
No.
Okay. When you feel this is weakness, you are working or you are on rest or what's the exact what you are doing?
At home, preparing the lunch, doctor.
Mm-hmm. Okay. Is there any member of your family have a similar condition like this?
No, doctor.
Okay. Do you have any history of high blood pressure or high blood glucose?
Never, doctor.
Or high lipid, high cholesterol level?
No, doctor.
Okay. I will start to examine you.
Okay.
While we are continuing our discussion.
Okay, what you're going to examine?
Okay. I will examine the general look of the patient. The speech is normal. I will examine the right side, any weakness. I will examine for power, reflex.
Reflex.
Okay, examine for sensation.
No need, doctor.
Okay, examine the vision.
It's okay, doctor.
I will examine the pulse. Examine the pulse.
Okay, the pulse is regular and equally both sides.
If it is okay, examine the heart or any murmur.
No murmurs. No need, doctor. She's okay.
Okay, we examine the carotids for any pruy.
Okay, normal.
Okay, we examine the visual field.
No need, doctor. It's okay, normal.
Okay. Mrs. Hala, may I know what is your job?
Yes, doctor. I'm working as a teacher.
Okay. With whom you are live?
I'm living with my father and my mother, doctor.
Okay. Are you married?
No.
Okay. May I know what is your concern?
I'm concerned about this weakness today, doctor. What it could be?
Okay. Mrs. Hala, with this weakness, so I ask you, is any shaking of your body?
What, doctor?
Hello?
Yes, again, doctor?
There is any shaking of your body before this weakness?
No, at all, doctor.
Okay. Mrs. Hala, from information that I gathered from you, it seems that your condition related to what we called mini stroke in your headpiece. First, I want to admit you, and we run some blood tests and some imaging of your head, of your brain. After that, according to the result, we will discuss management in future.
It could happen again, doctor?
I'm not sure about that. But according to the cause, it can be happen in future. Accordingly, but first we will run some blood tests and some imaging to know what is the exact cause of this weakness of your right side of your body.
Yes, doctor.
Okay. Do you have any other concern?
Oh, thank you, doctor. So what's your diagnosis and differential diagnosis?
Okay. First I put TIA.
Okay.
The second I will put
what could be the cause of
vasculitis, but I think in this young female, it could be related to thrombophilia.
Thrombophilia. Okay. So did you ask about history of blood clot or family history of blood clot or blood disease?
No, I forget to ask about.
Okay.
But I asked about family history of similar condition.
Okay, what else could be a cause of TIA in this young female?
I asked her about history of vasculitis or connective tissue disease, any skin rash, any negative in history.
Okay.
Any skin rash like this could be SLE related.
Okay.
The patient no symptoms.
Yeah, ABA.
It could be if he has symptoms. What?
ABS could be?
Sorry?
ABS
could be
syndrome?
It could be, but I forget to ask her about oral contraceptive pill. The patient on oral contraceptive pill or not.
Yeah.
Abortion
also blood clots?
A previous history of abortion.
Because the patient is not married. He said that he is not married before.
Not married, yeah, but can experience blood clots, EBT or maybe pulmonary blood. So blood clots as thrombophilia and antiphospholipid syndrome you have to ask about, okay. What else could be a cause of TIA in this young female patient?
Cardiac
cause.
I asked about if any awareness of heart problem, any murmur, any history of blackout. She says that no.
Yeah, what arrhythmia? So
even the urine examination, the arrhythmia, yes, but the pulse is regular.
Yeah, but
and the heart is no murmur.
Could be?
Yeah, it could be, yes.
Yeah.
Atrial myxoma? Could be atrial myxoma?
It could be, yeah, but according to the echo.
Okay.
Or datum foramen ovale.
Okay.
What are the
differential diagnosis rather than TIA?
Okay, could be migraine hemiplegia, but the patient has no history of headache in this young age.
Yes. Okay. So what investigation are you going to do for the patient?
I will do investigation in CBC, renal function test, serum protein, ESR.
Again, please.
I will do basic investigation.
Yeah.
In form of CBC.
Yeah.
Liver function, renal function, ESR, coagulation profile.
Yeah.
I will do for her ECG and echocardiography. I will do for her CT brain.
Yeah.
I will do for her Doppler, carotid Doppler.
Before going to such
CT brain, yes.
Investigation, CT brain, okay?
Yeah. Yes.
So after CT brain, ECG, echocardiography, Doppler ultrasound, Doppler carotid ultrasound. Okay, what else?
Autoimmune screening.
Anti-nuclear.
And double-stranded anti-nuclear antibody and anti-Smith for SLE suspicion.
Why SLE with patient with no joint pain or skin rash? This is relevant investigations. He will write in his notes that you are asking immediate investigations. Okay, 24-hour Holter.
Patient bedside will not do for her.
So, and the so 24-hour Holter is mandatory.
Yeah.
Isn't it? Okay, so this patient for admission or not?
No.
Why not?
No. Because according to ABCD score, it is less than 4.
Less than 4.
Patient with TIA, less than 4 years.
Okay,
the age
so
is less than
the
65.
ABCD score for the patient. A is age, okay, the age is 0 for this patient.
Age is less, yes. Age, B, blood pressure, there is no blood pressure.
Okay.
Clinical presentation.
Yes.
Clinical presentation about 2. Unilateral.
Unilateral weakness, so 2. She will take 2 in clinical presentation.
Duration.
Duration is
more than
so
1.
She will take 2 for duration more than 1
3.
hour. 1
2.
hour is 2 or 1?
2. 4. Less than 1 hour, 2. Means the score is 4.
Yeah, so score is 4 is need admission or not?
Need admission, yes, an urgent investigation.
Yes, so you told the patient already that you are going to be admitted.
Yeah.
Okay, so according to the ABCD score, this ABCD score is a measurement for the patient of admission or not for admission, urgent CT scan, inpatient CT scan, or outpatient CT scan. Okay, if the score is less than 4, so this patient can be discharged home and CT brain can be done within 2 weeks. If the score is more than 4, so 4 or more, so this patient has to be admitted and CT scan has to be done inpatient urgently.
24 hours.
Yes. A is age. Age, if the age is more than 65, so it takes 1. B, blood pressure is more than 140/90, it will take 1. Clinical, if the patient has weakness, it takes 2.
If slurred speech, 1.
Of loss of vision, 1. Slurred speech, 1. D, duration, if the duration is more than...
Duration.
If it is less than 10 minutes,
1 hour.
so it is less than 10 minutes, 0. From 10 minutes to 1 hour, 1. If it is more than
10.
1 hour, 2. This is the ABCD score for assessment of the patient for admission or not. So not all the patients with TIA for admission. Some patients with ABCD score less than 4 can be discharged home, and even CT brain can be done within 2 weeks and further investigation. So you missed in this case, Dr. May, just the hereditary thrombophilia and antiphospholipid syndrome to ask about. Menstrual, yes, and ask about menstrual cycle, also very important to ask in all female patients. Miss the portion if the patient is married. Okay. And history of blood clot or family history of blood clot or similar condition for hereditary thrombophilia and antiphospholipid syndrome. Migrainous hemiparesis is one of the we have to put in our mind, so you have to ask about history of headache. Functional hemiparesis in young female patient is predicted functional. It means that psychotic. So you have to ask about your mood and any stress you asked already about. And cardiac origin is very important. So you have to ask about tracing of heartbeats, chest pain, also short suppress. Of course, in the beginning, you have to ask about all the neurological symptoms for the patient, including headache, loss of consciousness, seizures in the form of shaking, sensory disturbance, uncontrolled urination or waterwork or back passage, abnormal gait, Then ask about cardiac symptoms, as we mentioned. Ask about antiphospholipid and the thrombophilia symptoms in the form of blood clot, and miss the portion if the patient is married, his family history of blood clot or similar condition. That is all in such this case. So it may be antiphospholipid, and if you miss the blood clot, maybe the only positive data is the patient has recurrent blood clots, So you have to consider antiphospholipid syndrome in the first differential diagnosis, not cardiac cause. So in this case, I'll put TIA because of cardiac origin, okay, mostly, maybe arrhythmia or valvular lesion, which need echo assessment in the first differential diagnosis. Okay. Regarding the examination, examine the neurological system, tone, power, reflex, coordination, sensation, but of course the examiner will not let you to examine all the neurological system. Just start with examining the motor power, then he will tell you it's okay, doctor, no need, complete your examination. Then shift to the heart, to the pulse first, to see if there is any pulse problem or irregularity in the pulse. Then to shift to the heart for valvular lesion, and also auscultate the carotid for any carotid narrowing, for example, or carotid pyrrhus. Then you can tell the doctor, I would like to complete my examination to examine the fundus of the patient, but she is not complaining of any visual disturbance actually, so no need. Okay. Any question regarding this case? CIA غالبا بيجيبوا surrogate ممثلة, okay, with nothing at all, with no clinical presentation. Easy case to come in the exam, and it's coming frequently. Okay. Any question?
No, I just have a comment, if you please, doctor. There is a similar case in the past videos, but with old age patient. So as according to the ABCD score, he should be admitted at once for further investigations.
Of course, if the score of the patient is 4 or more, she has to be admitted, of course. Don't forget to make the investigation by period investigation. I mean, انت يعني الدكتوره معي قالت السي تي في الاخر، وده ما ينفعش، لازم احط السي تي في الاول. الاكزامر هو ماسكك يقول لك she bought the CT in the end of the investigation. فبالتالي don't يعني give chance for the examiner to get you. انا عامل basic investigation in the form of CT scan at the first, okay, ECG, echocardiography, carotid Doppler, 24-hour Holter. بالشكل ده يبقى يعني investigation مرتبة على حسب الأهمية وعلى حسب البريوريتي.
CT scan first or carotid Doppler first?
No, of course CT scan first. carotid Doppler after the patient admission. ممكن تعمل بعد 2 أو 3 أيام كمان يعني. carotid Doppler طبعا عشان نشوف الكاروتيد لو السينوزس less than more than 70%, this patient will be referred to vascular surgery for end arterectomy.
I think also, Dr. Saadi, we do CT first because if you want to give the patient antiplatelet or anticoagulant, should be first to exclude hemorrhagic.
We want to know if it is hemorrhagic or thrombotic.
Yeah.
Of course, I agree with you completely. Okay, we finished today. Four cases, 2 cases communication, 2 cases history, station 5. Later on, inshallah, we can continue our sessions with more cases coming frequently in the exam for history taking and station 5, for example. Okay?
Thank you very much, Dr. Sadiq.
Thank you so much. I'm pleased to
Merci, Dr. Sadiq.
Have a nice day. Enjoy. Thank you. شكرا جزيلا ليك. شكرا لك.
جزاكم الله خيرا يا دكتور فاضل. جزاكم الله خيرا.
Thank you, Dr. Sadiq.
السلام عليكم.
شكرا دكتور.